On May 1, 2020, the Incident Command System activation in Benguet was expanded to a provincial-wide approach. Here are COVID-19 updates from the Benguet Provincial Government.
Hello, kabenggetan. Nabara nga kablaaw kanya tayo amin. Pagyamanan dagitoy frontliners, dagitoy health workers, doctors, and nurses, ditoy hospital tayo, kan dagitoy RHU, kapulisan para dagitoy patient order, kan dagitoy donors, kan volunteers nga nagititid ti cash kan vegetable nga naiwarwaras ditoy luglugar tayo ditoy Benguet. So makaya tayo daytoy nga labanan daytoy COVID-19 no agtultuloy tayo nga makiurnos ken nagtitinulong akas agkakabsat ditoy Benguet. We serve, we love, we heal as one.
Naimbag nga aldaw kada tayo amin. Daytoy iti case monitoring update from the province of Benguet. As of May 10, there are 9 confirmed cases, 1,698 suspect cases, 0 probable cases, and 6,566 possible cases. 4 of the confirmed COVID-19 positive cases have already recovered, while 5 confirmed COVID-19 are still admitted but are in stable condition. This morning, we received a confirmation from the DOH that a 26-year-old male from overseas and a resident of La Trinidad turned positive. As of May 11, Benguet has now a total of 10 confirmed cases. Due to apparent local or community transmission of the virus and the surge in cases, the Department of Health has decided to shift from classifying individuals as PUIs or PUMs to using case definition following guidelines from the World Health Organization. PUM, one who has been exposed to the virus but shows no symptoms. It is no longer included in the new classification, as residents are assumed to have been exposed due to local transmission but are still to be monitored and taken care of. Suspect case. Individual with influenza-like illness, symptoms include fever of at least 38 degrees centigrade and cough or sore throat, and either of the following: a history of travel or residence in an area that reported local transmission of COVID-19 during the 14 days prior to symptom onset, or with contact to a confirmed or probable case of COVID-19 during the 14 days prior to symptom onset. Individuals with sudden respiratory infection and severe symptoms like a shortness of breath, difficulty of breathing, or severe pneumonia with unknown case and require hospitalization. Individuals with fever or cough or shortness of breath or other respiratory signs or symptoms, and under any of the following conditions, like aged 60 years and above, with a comorbidity like hypertension, assessed as having high-risk pregnancy, or a health worker. Probable case. A suspect case whom testing for COVID-19 is inconclusive, or a suspect case who tested positive for COVID-19 but those tests was not conducted in a national or subnational reference laboratory or an officially accredited laboratory. Confirmed case. Any individual who was laboratory confirmed for COVID-19 through RT-PCR in a national or subnational reference laboratory or a DOH-certified laboratory testing facility. on the DOH-CHD CARRESO data, the status of COVID-19 cases tested as of May 10, 2020 in Benguet, there are a total of 1,045 specimens that have been tested, including repeat tests. 9 tested positive, 790 tested negative, and 246 with pending results. For case testing update, priority categories for the expanded testing is based on the DOH Department Memorandum 2020-0180. 1. COVID-19 expanded testing is defined as testing all individuals who are at risk of contracting COVID-19 infection. This includes the following groups. 1. Suspect cases. 2. Individuals with relevant history of travel and exposure or contact, whether symptomatic or asymptomatic. And 3. Healthcare workers with possible exposure, whether symptomatic or asymptomatic. The following exposures should have happened 2 days before or within 14 days from onset of symptoms of a confirmed or probable case. 1. Face-to-face contact with a confirmed case within 1 meter and for more than 15 minutes. Number 2. Direct physical contact with a confirmed case. Number 3. Direct care for a patient with probable or confirmed COVID-19 disease without using proper personal protective equipment. Close contacts of a confirmed 19 case are recommended for testing. The following reflects the subgroups of at-risk individuals arranged in order of greatest to lowest need for testing. Subgroup A, patients or healthcare workers with severe, critical symptoms, relevant history of travel or contact. Subgroup B, patients or healthcare workers with mild symptoms, relevant history of travel, and considered vulnerable. Subgroup C, patients or healthcare workers with mild symptoms, relevant history or travel or contact. Due to global shortage of testing kits and limitation in local capacity for testing, there is a need to rationalize available tests and prioritize subgroups A and B. However, in view of the expansion of testing capacity and to ensure healthcare workers' safety, the subgroup C will be tested and health workers prioritized. Based on current available evidence, real-time polymerase chain, or the RT-PCR testing is the confirmatory test. Rapid antibody-based test kits shall not be used as standalone test to definitively diagnose or rule out COVID-19. Dagiti sumaganad a palagip. Ipaay ti usto nga panaguyek. Kanayon nga agawit iti panyo wenno tissue. Aputan tingiwat ken agong babaen ti panagusar ti panyo wenno tissue. Mabalin met nga usaran iti manggas iti bado. Kada agbaen wenno aguyek. Umadayo kadagiti tattao no aguyek wenno agbaen. Maipagel ken lapdan iti agtupra iti komkompormi nga lugar. Ibeleng nga nasayaat, ije basuraan iti nausar nga tissue. Kanayunan nga agugas iti ima, kalpasan nga aguyek wenno agbaan. Kanayunan nga agugas nga naimbag iti imima, usaran ti sabon ken danom. Agradrad ti ima, usar ti alcohol, wenno sanitizer, no awan ti sabon ken danom. Lapdan ti makidin na kadagiti taraken nga ayo. Siguraduan nga naluto nga naimbag amin nga makmakan, ken lapdan ti agkilaw. Surutan ti maysa wenno duwa a metro nga distansya. Liklikan tay kuma ti panaguurnong ti tattao. Agannad iti fake news ken pakaammo nga agaputi online. Ken kanayon nga amuan iti nagapuan ti impormasyon. Papigsaan ti immune system tapno nakaradkad ken nasalunat nga kanayon. Lapdan ti panaginom ti arak ken agsigarilyo. We serve, we love, and heal as one. Thank you.